All right.
So I'll let you kind of moderate from this point, okay?
I very much appreciate that. Thank you so much for that extremely comprehensive presentation. So just for the audience sake, actually, do you want to let people know where they can find you
Yeah,
online and where they can find your books?
sure. My company's website is wellnessforumhealth.com. My email address is pampopper@msn.com. I do answer my emails if you send me one. I put out a newsletter every Monday, and I put out free videos. That's free. And I put out free videos Tuesday through Friday. And I also have a new healthcare newsletter that I put out every Monday as well. All that's free. So we try, and we have free classes from time to time. We try to do as much free stuff as we possibly can to get people thinking more about optimal health, because the goal is, if you guys would all be healthy, then I would probably have to find something else to do with myself, and that would be okay. I've got other things I could spend my time on too.
That's great. Thank you for sharing that information. So now we're going to begin the live Q&A session. I'll be asking some questions. The audience will be asking some questions. For the audience sake, for those who aren't familiar with this process, we don't take questions directly from chat. What we do is we ask audience members to raise their hand. To do so, you're going to click on the reactions button, second from the right at the bottom of the Zoom window, and then you'll select the raise hand function within the menu that pops up. I'll call on you. Just let us know where you're from and ask your question. And we just ask that questions are brief and on topic. And with that, I'm going to ask the first question. And, I'm 100% sure that you're aware in this, plant-based space that, there's a whole thing about oil and healthy fats versus not healthy fats. What are your thoughts on oil? Should it be avoided? And then how about other, quote, healthy fats like hemp, flax, olives in our diet? And does it cause or prevent disease?
Yeah, so the issue isn't healthy fats versus unhealthy fats, it's how much fat. And we don't advocate, and I never have, a fat-free diet. And so I think, first of all, when you're talking about flax seeds are great in a smoothie, I have those every day. And I make a wicked chickpea and avocado salad, and you'd really like it. And so I buy avocados and I put it in there, right? And I also make dishes that might involve nuts or something of that nature. But where you get into the danger zone, I think, on the higher fat foods is when you're going to the grocery store and you buy 5 avocados and bring them home and say, what am I going to do with these? Well, I'll put some avocado on my toast in the morning, 21 grams of fat per cup, right? And then I'll have some avocado in my salad at noon, and then I'll pour some oil-based dressing on it at 14 grams of fat per tablespoon. And this is why you have this phenomenon of the overweight, chubby plant eater who just has no concept of calorie density, right? So I don't think we have to become fanatical about eliminating all high-fat foods. I think we have to know the place, which is when you're making dishes and that sort of thing. One thing I'll point out, when I was a kid, this is how old I am. We had at holiday times, sometimes my mother would put out a bowl of nuts and a nutcracker. Remember that? Are you old enough to remember that?
I am.
Yeah. Okay. So my dad would crack open some of those nuts. It was a lot of work. You have about 3 of them, and that's all the time you've got for nut eating, right? So this idea that you buy a big bag and stick your hand in the bag, that's a modern thing that we didn't used to be able to do. As for the oils, again, I don't think that fanaticism is required. I've watched with abject horror while people clutch their chest and claim that a little shine on the asparagus in a restaurant is going to kill them, and I think that's ludicrous. But the other side of it is it's very high fat, 14 grams of fat per tablespoon. And in a country of obese and overweight people, I don't know that encouraging consumption of that kind of thing is a great idea. The other thing is, you'll find that I've never had anybody who adopted a lower fat, not fat-free, but lower fat diet, who said, you know what, I really miss all that fat I used to eat. What they really are looking for is good food. If it tastes good, you're not going to miss the oil.
Great, thank you. And do you recommend mammary glands, colonoscopies, or the new, I hope I'm saying this right, the Gallery blood test that detects over 50 types of cancers? Do you recommend all these tests for early detection of cancer? And what is the outcome of detecting these cancers early?
There is only one early detection test for cancer that works. And the definition of works is that it reduces your risk of dying from the cancer. And that's Pap testing for cervical cancer. It's actually effective. We are diagnosing abnormalities at earlier and early stages, so people are being overtreated, but it does actually reduce the risk of dying from cervical cancer. The blood tests are disease mongering tools. They're highly inaccurate. And so the problem with disease mongering is that you find a lot of inconsequential abnormalities that make people nervous, and they're counting on that because that's how they generate a lot of money. These are marketing tools for centers that make a lot of money on this. Colonoscopy, we now have a randomized controlled trial, first one. We recommended this as a standard test without any randomized controlled trials for decades, right? Now we have one. It was well done in Scandinavia, published last fall. Not only does colonoscopy not reduce your risk of dying from colon cancer, it doesn't reduce your risk of getting colon cancer. All that polyp snipping doesn't help you at all. All right. Mammograms, the risk that you will be harmed, significantly greater than the chance that you will benefit. And by the way, I'm not for rationing any of these things. I'm for informed consent. And so I don't know if you've ever sat through a mortgage closing. I'm sure you have, like I have, and it takes 3 hours. And they read this, and you have to initial and say you understand it, and all that. And the interest rate could go up, and property taxes in this new development haven't been set yet, and blah 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 blah. Right? There is no requirement. And by the way, a mortgage banker who doesn't do that, if it was systemic, they can go to prison for it. Some of them did, right? Mm-hmm. Okay, there is no consequence for a physician recommending a test or any procedure or medical treatment for which there is little to no evidence and not informing the patient before doing it. That's what I want to change before I leave this planet. So it's a long answer to your question, but if you want to lower your risk of cancer, you're not going to do it hanging out with doctors, having every body part tested every so often. You're going to do it by paying attention to how you're living your life. I am reducing my risk of cancer all day long today. I'm drinking water. I had a great breakfast. I'm going to have an equally great lunch and an equally great dinner. The sun is shining. I'm going to go out and work in my yard a little bit. I'm going to get some sun, produce some vitamin D, and I'm going to go for a run tonight. All right. That's how you reduce your risk of cancer. It's not hanging out with doctors, having invasive tests performed.
What are your thoughts with regard to with these genetic tests? For example, the BRCA1 gene, and then people, women prophylactically getting mastectomies out of fear of this gene, and what they're being told is a likelihood that they're going to get cancer.
Well, we now have some data going out 10 years, one study on mastectomy, bilateral mastectomy or no mastectomy, and there's a 3% survival advantage. I don't know that most women would have their breasts taken off if they knew that. And by the way, you have an equally higher risk of pancreatic cancer. So maybe you ought to have your pancreas taken out while you're having your breasts taken off and the ovaries taken out. I mean, it's just another form of profitable butchery, in my opinion. And it distracts from what really makes a difference. And it's something I want to say here, because everybody has a different risk threshold and that sort of thing. But first of all, we're making false promises to people when we promote these things because they really think it makes a difference. But the second thing is you can't go through life thinking that the secret to a long life is avoiding illness. Like, what am I going to do today to not get sick? Well, I'll just stay home and be in my basement and see no humans. What can you do to avoid all risk? So what you have to do is you have to put risk in perspective. People say, well, how am I going to feel confident about my health if I don't have a colonoscopy and I don't have a mammogram? Well, I don't know. It's the same as driving a car. I cannot avoid all accidents unless I stop driving, right? So here's what I do. I have a car that's in good working order. I have insurance. I maintain my car. I fasten my seatbelt and I follow the speed limit. And I live in a school zone, so I'm really mindful. Kids all over the place, right? And I don't drive when it's a sheet of ice out there. And if it's raining so hard I can't see the street from here, I don't drive. All right, so all that's to be careful, right? But I cannot help it if a bus runs into broadsides me on the way to the office later this afternoon. Nothing you can do about that. And so sitting around thinking about it all day long, oh my God, I drive, I could get in an accident. That's the medical profession has profited greatly from teaching people to be terrified about their health all the time and think that this constant testing and intervention is what builds health. It doesn't.
And one more question before I turn it over to the audience for a few questions. What are the survival rates for different types of cancers, and what do we do to reduce the risk of getting cancer?
To reduce the risk of getting cancer, pay attention to your diet, your weight, and there's a lot of other stuff too. I recommend reading a book called Radical Remission by Kelly Turner. She interviewed 1,000 people who had terminal diagnoses, essentially, who survived, to find out what they did to survive. And they all reported like all kinds of different things, but all 1,000 reported the same 9 things. And those were, they focused on their diet, they followed their intuition. I love this part. Their doctors described them as being annoying because they wouldn't follow directions. They believed that they should make their own choices. They did use supplements judiciously. It was not the indiscriminate, everybody takes kind of usage. They felt that having a purpose in life was important. Social connections were important. They also felt that something was out of whack in their life that caused them to get cancer, and they needed to fix that, right? So I think that I know a lot of people who think that as long as they just watch every morsel that goes in their mouth and never touch salt, that protects them against everything. But I think that the biggest protection really is taking great care of yourself, keeping yourself in as good a health as possible, and living a great life. I think my health is attributable as much to my close friends, my community connections, I love what I do. I look forward every day. Animals are a passion of mine. Some of you know I adopted a new little friend after Schroeder died last year. So Sir Winston lives here now. And that makes me laugh all day long. He's been a very good boy during this, by the way, because I wore him out before we started. But you have to have laughter, and you have to have social connections with people. That's how you avoid cancer. Survival rates, I have seen people who should have survived die. I have seen people who should have been dead live for 20 years. And so there's the definable part of it, eating well, losing weight, and all that. And then there's, we call it in our office, the X factor. It's like determination to live. There is such a thing as an expectation effect. And there's a book by that title that we studied in our Healthy Book Club for members. And it's astounding how much of what happens to you is dependent on your expectation. And I'm not talking about sit back and wish yourself well. I'm just talking about you get what you expect in life. And people who expect to live often do. People who expect to succeed often do. And so I tell people, really, the chatter in your head. I just read a book called A Liberated Mind by Daniel Hayes. And I love this line. Step 1 in changing things, put your mind on a leash. I love that statement. And since this is another book we studied in our Healthy Book Club. And since then, about 25 times I have said, Pam, you have got to put your mind on a leash right now because you're going on. I know I do it. Everybody does, right? Bring yourself back. So there's a lot to be said for just making up your mind about how things are going to be.
Great. All right. So our first audience question is going to come from Dave. Where are you from and what's your question?
Hi, thank you for your presentation, Doctor. I'm Dave from Massachusetts, and I would like to know what is your opinion about omega-3 blood test. Do you think it's legit? Do you think there is enough research that show that if you have a deficiency, you have a problem? And if you think if it is legit, what would you recommend to mitigate it, either using supplement or control the ratio between omega-3 and 6? Thank you so much.
I think that people should stop having testing done unless there's a reason. All right. This is another thing. There's a great book called Risky Medicine, written several years ago. It's another one we studied in our book club. And what this doctor talked about is the more you test, the more you find. That's how you turn healthy people into sick patients. And you essentially, you find risk factors, and then you treat the person as if the risk factor is actually the disease. That's what happens with mammography, by the way. All right, you find ductal carcinoma in situ, which is the risk factor for cancer. It's not cancer, but we're going to treat it like cancer. I mean, a lot of women have surgery and radiation, and so I think if you don't have a profound reason for having tests done, I would avoid them all. I haven't seen a doctor since 1994. It's a personal choice and not one that I'm necessarily recommending to you, but I'm just asking. I'm 119 pounds. I weigh what I weighed when I graduated from high school. I'm 66 years old. When in a pinch, I can run an 8-minute mile. I work out every day. I own a hot yoga studio and teach hot yoga. I'm capable of outworking anybody a third my age. So I'm just wondering, what would be the reason for calling a doctor saying, you know what, let's look for something wrong. Let's see if we can find something. And I'm pretty sure at this age you'd find some abnormality, but the question is, do I benefit from knowing about it? And I'm not sure that I do. Actually, I'm sure that I don't, which is why I'm not doing it.